Hey y'all, I'm Dr. Matt Lucero here in snowy Denver, Colorado, and in this week's Tuesday tip I want to talk with you about the versatility of Neol Liner LC and give you a couple of examples of how I like to use it in conjunction with NeoPUTTY MTA to provide vital pulp therapy for my patients. In this first case, you can see our patient had extensive decay on teeth 7 through 10. We ended up with a carious pulp exposure on tooth number 7, so we did a direct pulp cap using NeoPUTTY MTA. Now the important part here is that we use Neol Liner to help seal that MTA in so that we could do our bonding protocol and then place composite restorations just like we would on any other patient. That's what Neol Liner allows us to do. It keeps our MTAs safe while we place our etch, rinse, and then place our bond. This next case is slightly different because I'm going to use NeoPUTTY as an indirect pulp capping material. Now on this tooth we had deep decay on number 19 and I wasn't quite sure if I had a pulp exposure, so I want to place a pure MTA product. Since Neol Liner contains resin, it's only for indirect pulp capping, and if by chance there was a pulp exposure, that resin could lead to problems with the pulp. So I place Neol Liner over the top of my MTA, then I cure it in place. Now that keeps the MTA sealed off while I use my etch and bond, and then I can place my composite. You can see in the final restoration just how deep that prep was. We have our MTA and then we have our Neol Liner sealing it in. That allowed me to place my composite restoration over the top. As you can see, Neol Liner LC is much more than an indirect pulp capping material. I invite you to give it a try and see just how easy it can make vital pulp therapy.